Good morning, everyone. Welcome to our October Negociantes for today. Sorry, my name is Sandra Pedro, and I'm excited for everyone to be joining us this morning. Our keynote speaker for today is Dr. John Graneto, and we are excited to have him join us for our last virtual meeting of the year. Before getting started, I would like to share with you a little bit on the chat box feature. That way you can submit your questions throughout the presentation. If you're accessing today's webinar using a computer, you will find this feature by clicking the chat box that appears on your screen. And if you're using a tablet or a mobile device, you will find this feature by selecting the More option, followed by the Chat option. Y quiero anunciar que la presentación de hoy se ha estado transmitiendo en vivo en español, así que gracias al equipo de lingüística, interpreting and translation. Así que para poder escuchar la presentación de hoy, simplemente seleccione donde dice Language Interpretation y haga selección a español y asegúrese de silenciar el audio original. I just shared instructions on how to use the Zoom feature if you wish to listen to today's presentation in Spanish, which is provided by the team at Lingüística, Interpreting and Translation. I would now like to welcome our Chief Operating Officer, my team member, Yeri Olivares, for some welcome remarks. Yeri, welcome.
Thank you, Sandra. Good morning, and good morning, everyone. Thank you so much for joining us this morning. It is good to see a lot of you that, we haven't been able to see each other face to face, but it's great to see that you took the time to join us this morning. We would like to start by thanking Dr. Graneto for joining us this morning. I'll be doing a short introduction of him in a little bit here, but first, what I would like to do is move forward with thanking our sponsors. We would like to thank Bank of America, Comcast, Bank of the West, Chevron, FHL Bank San Francisco, Donna G. Sells, Wells Fargo, Tri-Counties Bank, JP Morgan Chase, and Union Bank. And, we want to thank them for their support. Without them, we would not be able to do the work that we're doing in our community with the small businesses. So thank you so much to our sponsors. Next, I would like to share with you that the Fresno Area Hispanic Foundation continues to provide virtual technical assistance to our small businesses here in the area. And we do that by providing one-on-one consultations over the phone or via Zoom to help them with their business and see where it is that we can help them, as they're building back and recovering or trying to recover as they're opening back up, their businesses. We also have the weekly webinars, of which include the Womanpreneur and Latinapreneur program. As some of you might have already seen, we made a really nice announcement this week. We were able to provide $50,000 in grants to women entrepreneurs that participated in this program, which is designed to help women entrepreneurs grow their business by implementing digital marketing tools and develop their strategic marketing plan. So that was really exciting that we were able to do that this week. We also continue with our microloan program, which is a program that we have to offer financing to small businesses here in the Central Valley. And so we assist them with the loan application, and we help them also identify other resources, including relief funds that may be available for them to either get started or continue the operations of their business. So please feel free to contact us anytime. Our team is here to assist you. We also have, we have social media presence, so please follow us there as well so that you can be up to date with all of the different activities that we have going on. So without further ado, I would like to introduce our keynote speaker for this morning, Dr. John Graneto. He is the Dean of Osteopathic Medicine at California Health Science University. He is a graduate, 1986 graduate of the Ohio University Heritage College of Osteopathic Medicine. He is board certified in both emergency medicine and pediatrics. Dr. Graneto is fellow of the National Academy of Osteopathic Medical Educators and is a past chair of the AACOM Society of Osteopathic Medical Educators. Previously, he was formerly the founding chair of the clinical integration at Chicago College of Osteopathic Medicine, Midwestern University, and the associate dean at Kansas City University. Dr. Graneto is the dean of the new College of Osteopathic Medicine here at the California Health Sciences University in Clovis, California, and we are very happy to have you here this morning. Dr. Graneto, thank you so much for joining us. Welcome.
And welcome to everyone. Thank you for having us do the presentation this morning. And I appreciate the opportunity to share with you the challenges and some of the features of having a new medical school right here in Clovis. This is so exciting for all of us. I'm going to share my screen. Right, there we go. Okay, so you can see my screen. Buenos dias a todos, and we'll start with some explanation of why we're here. Joining me this morning is Dr. Noemi Barriga, and Dr. Barriga is our residency match and manager and career counselor for our students, and she's going to answer some questions and do some of the presentation with me this morning. Here we are in one of the richest states of the United States, and we have some of the poorest health outcomes right here in the Central Valley. I don't have to tell you all that. I moved here 3 years ago to take on this adventure and to join in the university's mission to help alleviate this problem by growing our own physicians right here in the Central Valley. We know that lack of access to care is one of the biggest problems in health disparities in the United States, and right here in the Central Valley, it's very clear. We need more providers in order to help decrease some of the health inequities in the Central Valley. Look at that, we need at least 8,000 new primary care physicians by the year 2030. So prior to 2019, prior to us starting here, all the top 50 United States cities had a full 4-year medical school from start to finish. And we know from start to finish, if you start recruiting people from a local area and they spend all 4 years right here in their hometown, the likelihood that they'll practice here is huge. And all of the top 50 United States cities already had that in effect, except the 35th largest city in the United States, which is Fresno. And that just was shocking to me. And that that leads to a brain drain for our own youth. They grow up in high school and they don't see a clear path to a professional healthcare career without moving to the big cities, the Bay Area or Southern California. And so your children, your cousins, they're leaving town because they have no other place to go for a career, or they want to leave town, but they can't because they have to stay with family commitments here in the Valley. So that's why we're here. There's a lot of medical schools in California. But if you look at the bottom right, we're going to be graduating just under 2,000 new doctors a year with all of the medical schools in California. That's nowhere near going to make up for the 8,000 we need in the next 10 years. We have a long way to go to graduate more physicians in California, let alone keeping them in the Central Valley. And here you see a picture of that. When students graduate from medical school, no matter where they go to medical school, their residency opportunities, again, are clustered in large urban areas like the Bay Area and in Southern California. So our job is to grow additional residency programs as well. So you can tour our virtually tour our building on our website. And here we are in Clovis. It's a pretty campus. We built a nice, shiny new building with a courtyard and beautiful landscaping. I'm going to put the link to the tour of the building into the chat box so you can. Well, maybe I won't. Maybe I'll do that a little bit later. Here we are. This is the leadership. So myself and 5 deans, associate deans, all moved here. All moved here from out of state to help run the school. Now, why would we do that? We could work anywhere. And the reason is because of the mission of recruiting and retaining local students, reflecting the diversity of the community we serve, is really a great challenge and a great opportunity when you're starting a brand new medical school. To aid me in this endeavor, I enlisted the support of some community members to serve on the Dean's Advisory Council. And you will recognize many of the names here as very influential leaders in healthcare and in education around the Central Valley. And this group of leaders I talk with, and we talk about the challenges of what it's like to develop a medical school and how are we going to keep the students here after they graduate, and also how are we going to recruit students from the local colleges and even down into the high schools to know that they have a clear path towards a professional medical education here in the Central Valley. So what have we done in that regard? So first of all, we did, when we first got here, we did an MCAT prep course. MCAT being one of the barriers to get into medical school. We thought we should reach out to some of our local students and offer a preparatory course. And we did it at a very low cost over 10 weekends last summer, or 2 summers ago now, a very intense review. And several of those students were able to increase their MCAT scores and apply to our school and are seated downstairs right now in this building. We also did a pre-med boot camp also in last fall, just for 4 Saturdays, how to prepare a CV, how to write a personal statement. We did some mock interviews. And what we found when we interviewed those, when we hosted those students was that the disparity with which some students get advising in their high school and college is variable. And not all students are receiving what we think might be the most up-to-date or the most clear direct route to going to medical school, and some advice for how to go to medical school or how to go to pharmacy school or any other professional healthcare doctorate program. And we're going to continue to do these 2 courses because we think supporting our local college students is very important. So in July, we started our first class of medical students. We have 79 students here already in this building. And this is the colleges they came from. 59% of the class came from colleges here in California. And you can see the disparity of where they're not coming from. And we have to reach out to some of these institutions where maybe we're not able to reach a vast portion of the student body and help them understand they have a clear path to getting into medical school and to stay right here in the Central Valley. The profile of our class is very dramatic. We had 79 students in our first class. And to get 79 students, we have almost 4,000 applications to come to medical school here. And that's just shocking to me, the number of people who want to come to medical school, and we just don't have enough spots in the state. Here's the average GPA of our students and the average MCAT score. We have minimums and requirements all posted on our website, and the final answer of these 79 students, their final averages are listed right here. So a nice academically sound and solid group of students for sure. But we have some great diversity metrics, including 27 languages are spoken. By 79 students, 27 languages are spoken by that group. And that is very reflective of the diversity of the one metric of the diversity of our class. And 30% hablan español, which was very important to us to help understand the impact we're going to have here in the Central Valley. So already 30% of the class self-identifies as native Spanish speakers or had learned Spanish along the way in their career. Some non-traditional students who had already obtained a master's degree after college, or 3 students who have a doctoral degree, decided to come to medical school after their second career. In fact, that's reflected by their age group, which we're going to talk about in a minute. We're about 50-50 male-female. We are 34% from the Central Valley, and we chose a handful of students outside of the state to add to the diversity of thought and the backgrounds of students who are coming from not necessarily California, but may have some important aspects to add to the diversity or to the region. Our mean age is 26, with the highest to oldest student being 42 years old. Again, 42, 39, and 37 are the ages of the top 3 students, oldest students in our class, which is a non-traditional and atypical of most medical schools, where you think a pre-med student might graduate from college and be about 21 or 22 when they enter medical school. So we certainly have plenty of those, but we have some older students too. Okay, medical school is hard. It's very hard. And this is a very busy slide on purpose to show you the complexity of the coursework that the students take. All 79 students march through the curriculum in most medical schools in the exact same order, the exact same format, and the exact same cohort. There's no variation or choosing. In fact, our registrar enrolls students directly for all the students at one time. But it's hard, and it's jam-packed full of science information as well as physician courses. You'll see at the third to the bottom ribbon, we have medical Spanish. In fact, we have a required medical Spanish course. That is atypical of medical schools. Most medical schools in an urban setting or in a setting serving Latino population has some elective in Spanish for students who choose that. And we decided we would make that a requirement for each and every student coming to our school. So for the first 2 years, we have a medical Spanish class. Dr. Daniel Gutierrez from the Clovis Community College is our adjunct professor over here and teaches that class in the afternoons on Thursdays. We jam-pack this again in the second year. Medical school is hard, es muy difícil. And we have all of these science courses in the top ribbon jam-packed and concentrated into 4-week blocks. And each of those 4-week blocks has quizzes, a midterm, and a final exam. And that's unlike their college experience. So it's a very rigorous curriculum in most medical schools, very rigorous curriculum. Es muy difícil. And so it's not going to be possible for your children to be at home on Sunday for pozole. It's a very different experience from just going to college. And so helping families understand the challenge and helping abuelos understand this experience is very different from going to college, because medical students are going to miss graduation from their little brother or maybe a special event from the family, and they're not going to be home on Sundays every Sunday because they're going to be busy studying. And so for us, a challenge in establishing the medical school is getting that message out to the families as well. I will ask Dr. Barriga now to talk about a few slides and some points so that I can catch my breath and have a sip of café. Dr. Barriga.
Muchas gracias, Dr. Graneto, and good morning to everyone. Definitivamente va a ser muy difícil poder tomar el pozole por 2 años más. And we have here what happens in the third year. In the third year, students will put all that theory learned in the first and second years, and they're gonna bring this theory and they're gonna apply it to a live patient. In this year, students will complete required rotations, such as you see internal medicine, family medicine, pediatrics, obstetrics, psychiatry, surgery, and they also get to select a elective, something of their interest in that year. So they must complete these required rotations in the third year. In the fourth year, they continue to rotate in these various specialties at different in different types of health systems, health institution systems. So they resume their rotations in primary care, in again various specialties, can be urology, can be neurology, emergency medicine. But in the fourth year, they have the opportunity to go into 6 electives or 6 rotations that they feel they're highly interested, which also help define that specialty that they're going to apply for to get into residency and become a licensed physician of. Okay. So these core clerkships that we're talking about are hosted by hospital-based health systems in our area, as well as the community-based. It could be like the outpatient clinics and so forth. Aside from that, in the fourth year, they resume to come back on campus and have education days or didactics where they present cases with their peers, their colleagues, and discuss these, as well as Dr. Graneto mentioned, the continual exam taking, okay? So the question here is, are there sufficient clerkships or rotation opportunities in our area? What do you think? Por supuesto. Yeah, next slide. Existen 9 hospitales a corta distancia en automóvil, los cuales ofrecen suficientes oportunidades para que los estudiantes aprendan con doctores de una variedad de especialidades. There are definitely 9 hospital systems in approximately 1 hour drive that offer these great opportunities for our students to rotate with doctors from the various specialties that we just covered. And as you can see, this is our region here. And this is definitely, as you can appreciate, what the Central Valley covers. Back to you, Dr. Graneto.
Yeah, thank you, Dr. Barriga. Muchas gracias. So why do students come here when they could go anywhere else? Well, staying close to home is very important. And Dr. Barriga points that out because driving distance and staying close to home is very important for all 4 years. We also have some other unique features to our curriculum. We're here in the agriculturally rich Central Valley, so we put a nutrition emphasis throughout our curriculum. And to further emphasize that, we added a demonstration quality studio-ready teaching kitchen and hired doctoral level dietitians to teach the nutrition portion of the curriculum in this teaching kitchen, which we can broadcast out and do by Zoom, or we can do it live when the COVID restrictions are reduced. Not only for our students, but also for the community. So having events like how to cook for somebody with diabetes, how to shop for somebody who has a gluten allergy, all very important issues facing all of us in this agriculturally based economy. Students need to be competitive when they graduate from a new school. So one of the challenges we have as a new school is we don't have a reputation, and students get out to compete for residency programs. We need to make them, showcase them as bright as possible. Having experience in bedside at the point of care, ultrasound is very important. And so teaching students ultrasound from day one is an important feature of our curriculum that not everybody has. So we've added that, and we've hired adjunct ultrasound faculty to augment our physicians who are already skilled in ultrasound to teach this ultrasound connected to their smartphone. Now we have holographic anatomy in partnership with Case Western Reserve University. I'm going to click the link to our video for that as well. In the chat box. So you can take a look at that video. It's 2 minutes long. What we're seeing here is wearing augmented reality Microsoft HoloLens. And what the students see when they wear that together is a pop-up holographic image of the human being, of the body of male and female anatomy, as you can see demonstrated here. This is augmented reality allows for some collaboration. So we put students in groups of 4 and they're able to dissect the human body virtually without the smell, mess, and safety regulations required to dissect a cadaver. This is the wave of the future to teach anatomy. And Case Western Reserve University, a very prestigious university in Cleveland Medical School, has developed this licensing agreement, and we were selected to be one of their partner schools to continue to gather educational outcomes data to prove its effectiveness in learning. Our crown jewel of our building, and this is the building we're in right now. I'm seated right here in this office right here on the 3rd floor, and it's beautiful sunshine morning here. The crown jewel is our simulation center, where we have a simulated doctor's office setting with 12 exam rooms and standardized patients that are trained and hired to be sort of actors and read a script while the faculty watches over them from a control room, all before they get out into their clinical settings. We have a 7-bed hospital wing, simulated hospital wing in our medical school building that looks like an operating room with a nurse's station, ER, ICU, mannequins that talk to the students and display vital signs on the monitors, including neonatal resuscitation, mother-baby birthing, etc. The full gamut of simulated experiences for students to experience. All watched over through control rooms and done in group settings, as you can see here, with some of our current students. Dr. Barriga is going to talk about what happens after residency, what happens after medical school, and Dr. Barriga is next again.
So definitely, so once these students have finalized that 4th year, or let's say right around the midway of that 4th year, these DO students, Doctor of Osteopathic Medicine, our students, join the other medical Doctor of Medicine students into the same match pathway. So since March 2020, we no longer have another accrediting body to accredit specific residency programs for our DO students to enter. Now the Accreditation Council of Graduate Medical Education, or ACGME, is the only governing body to accredit these health institutions that are sponsoring these residency programs to have our DO and MD students together in this residency training. Now, all residency programs, like I said, are accredited only through ACGME. And as we see here, our DO students match 99% in residency. So there's no, now no such thing as a DO residency influenced program anymore, or an MD influenced program anymore. Now they're all combined, which is a great thing. And as you can see here, definitely in our Central Valley, we have this data to show us that there's been an upward trend in the increase of these residency physician positions and the residency programs in our valley. So as you can see at the bottom, as it's color coded, we have the various health institutions that host residency programs in our Central Valley, as you recall from that map. And since 2016, there's been an increase where these programs have applied for an increase of positions to these programs. For instance, I'll give you an example. If it's a family medicine program, this is a 3-year residency training, right, to become licensed physician. So some programs may start at 2 residents that they accept once they enter this match. So some start at 4. Well, in our residency programs, these have applied to ACGME to have that increase, and most programs have been accepted for an increase to up to 6 or 8 positions. So as you can see here, the upward trend from 2016 to 2021, it continues to rise. So like Dr. Graneto has stated, we definitely have positions available for all of our students in our area who want to become licensed physicians to serve our Central Valley. Back to you, Dr. Graneto.
Okay, and I think with that, we are done with our formal presentation and happy to take questions. So please ask us questions. I see in the chat box already the same theme, but 2 separate questions. So I'll turn it back to the moderator if you want to moderate these questions.
Absolutely. Thank you so much for today's presentation. A lot of exciting news happening during these times, especially the class of 2024 that, you know, they got the experience of doing work remotely and you know, it's following all the safety measures to be in the classroom setting. So thank you for the great support that the team is doing at CHSU. One of the questions here is, what is CHSU doing to reach out to Hispanics? I know we need more Latinos and Latinas in the medical field.
Right, and that's an important question for sure. And the follow-up question is similar for African-American students. And so our challenges are reaching minority students, or typically non-white students who have been long, and mostly male students who have long been the privileged few to come to medical school. That's a challenge for every medical school in the country. Now, our job is to reach down to the high school level and early in college level to groups of minority students who may not see the opportunity they have to come to medical school. Our biggest feature, our biggest ambassador for these recruitment efforts is going to be our current students. And so if we can get a handful of Hispanic Latino students who are from the area, who went to high school here or college here, they're going to be the biggest ambassadors for us. And so we waited until our first cohort of students was here, and we're going to start that ambassador program into the high schools for sure. We have a grant from the National Library of Medicine, actually, to start some high school boot camps for minority students. And so reaching into our high school and our zip codes where minority students are coming from smaller towns around the community here to help introduce them to high school students, to our current students who may look like them, who may speak the same language, etc.
Absolutely. Thank
you. The challenge in our area for African American students is even greater, as it is nationally across the country, as the percent population of African American students is even smaller than in some larger urban areas. And so the recruitment efforts for African American students is even harder because of that. And so we have to relook at how far our reach is to colleges that are maybe predominantly historically Black colleges and universities, or universities that have a larger portion of African American students.
Thank you. And we have another question here by one of our participants. And the question is there financial education courses to potential applicants for the medical school? And also, are there any scholarships for local, low-income, academically high-qualified students?
Yeah, so the financial education modules are provided by our national organization, and there's a link to that on our website as well, on how, what's it like to go to medical school, what's the cost, what's the budget, where do you go to get loans and scholarships, etc. We do have a small but growing pool of money for scholarships. You know that larger established universities have very large endowments from their alumni, and they're able to offer significant scholarships. And you see the national news where some new medical schools are even offering free tuition. It's because they're backed by much larger alumni donations. We don't have that yet. It's our first year in operation as a medical school. But we do have a small number of scholarships, and we're going to be posting our scholarship recipients and some biographies of them online so that students can see how to apply. And that is on our financial aid webpage, page on our website.
Okay, thank you. And the following question here reads, with the lack of access and higher education opportunities in the Central Valley, what prerequisite courses are you struggling to help students meet prior to being accepted?
So our prerequisite courses, we're re-looking at that because there's actually some national trend that says perhaps being so prescriptive in prerequisite courses might actually be doing a disservice to many students who may not have access to those specific courses in their college. We do know, though, that to take the MCAT, you need the basics of biochemistry and the basics of chemistry, biology, etc. And so not sure we have a specific struggle with any specific course. I see Brooks has asked that question. What prerequisite courses are you struggling to help students meet? I'm not sure that's a trend that we've identified yet as a specific problem.
And the following question reads, how has the COVID-19 pandemic impacted the interest of new medical students?
So we were very concerned that the COVID would decrease the application cycle, and in fact, it's about the same as last year. We have over 3,000 applications already for this current cycle, and we anticipate getting close to 4,000 again. What's interesting is that those applications came in much earlier than last year, so that's one of the trends we're seeing. We're seeing, because we're doing interviews virtually, we're seeing a lot more students who may or may not have been able to travel here if they're not from the Central Valley. So the applicant pool includes students from out of state a little more than previously. Our last interview day, this past Monday, we had 12 students and 10 of them were from the Central Valley. So we have not seen a major impact because of the COVID.
And looks like those are some of the questions that have been submitted here. And I would like to ask a question in regards to the bridge and the connection on how the CHSU can be to our rural communities within Fresno County, within the Central Valley. So I'm interested in knowing, what some of these activities would look like of students putting into practice what they're learning in the school setting.
So one of our unique features of our curriculum is our early service learning opportunity. We're placing students in resource limited environment in their longitudinal clinics from the first year, mostly federally qualified health centers or community health centers. And they're going to be embedded with the care coordination team at first, not with the physicians, so that they can understand the physician's role in the health systems and the impact of having those resource limited clinical settings in the public health arena. Each student will then be guided through a population health research project so that they can understand the impact. Again, they can study the impact of having those clinical sites in rural and less served areas. It's one thing to train medical students in a system where there's a big shiny hospital right next door to the medical school where you can see every subspecialist practicing, and you can get a CAT scan with a simple click of a mouse as a physician. But it's another thing to practice medicine in a clinic where you can't even explain to grandma how to get to the store to buy a walker because she came with arthritic hips. And the students need to understand the struggles that the patients have in accessing healthcare and accessing healthcare services in these resource limited environments. And so studying that from a population health perspective is a very important part of our curriculum.
Thank you so much. And we have another question here from Dr. Tatiana Pardo. And the question reads, as a leader in public health, one of the biggest problems is reaching out to the rural areas to prevent and educate, especially in the non-communicable diseases. Has the career program, or is there a comprehensive program?
Well, the first thing we do is we have a new course that's not typical in medical schools that is called the Physician's Role in the Health System, PRHS. And in that role, in that system course, we have chief medical officers from the FQHCs come and talk to the students about the impact of disease prevention. This is part of the osteopathic medical school historical background. We graduate students that are generally more interested in primary care, and we want to hold that role model out to all of our students, understanding the role, the impact that a physician has in preventing disease is as important as treating diseases. So in our PRHS class, we definitely talk about that and instill that very early on in their curriculum in the first year. that continues throughout their longitudinal service experience in the second and third year as well.
Thank you. Well, it looks like those are all the questions for now. And is there a phone number that our participants can share? Perhaps there's a student that's aspiring, a high school student aspiring to pursue medical career and you know, making that connection with the team.
Yeah. So one of the things is best served through our admissions email address, not necessarily a phone number. You could imagine with 4,000 applicants, I'm not sure we can answer everybody's phone number, but what we do have, and I'm looking on our website right now, is our general information nights. COM Info Night. I'm going to get that link for you right now, because we do answer some of the same questions again and again for similar reasons, for similar students. So we have a COM Info Night, and I'm getting back to the chat box. Here we go. And I'm going to post this for everyone so you can see. So if you have interested students that want to hear more about the school, they can attend one of these information sessions and chat with us, my associate deans, the director of admissions, et cetera, and have their questions answered in a very similar format as this.
Absolutely. Well, thank you so much, Dr. Graneto, and also Dr. Noemi Barriga for today's presentation. A lot of great things happening here in our Central Valley, and the recruitment and the talent of our future leaders. So thank you so much for today's presentation.
Thank you all, and
Thank you.
And
thank you for having us.
Absolutely. And we will now be transitioning into saying thank you to our renewal members for the month of October. And that is going to be DNV Unlimited Printing Company, located in Chowchilla, California, and also Chavez Web Design LLC, who are located in Visalia, California. Thank you so much for your support towards the organization. And before transitioning onto our virtual networking session that we've introduced during these virtual Negociantes Unidos breakfast meetings, I want to share that we have 2 webinars that our organization will be participating, and they happen to both be today. So the very first one is in partnership with University of Phoenix. We will be having faculty from the Central Valley campus and the Sacramento area campus cover topics in regards to social media adaptation for small businesses, how to create a sustainable plan for the growth of your business during these unprecedented times. And that presentation, that webinar conversation, will be today at 12, from 12 to 1 p.m. And shortly after, we will be having an opportunity for local businesses here in the city of Fresno that are interested in knowing the procurement process on how to do business with the city of Fresno. And this webinar will be taking place today at 2 p.m. And I'll make sure to share the links right now in the chat box feature. So if you have any information, you can visit our website at fresnoahf.org/events to register for both of these events or future events. And with that, I would now like to transition and welcome those that would like to participate in our networking activity session. We will be having an opportunity for you to network, introduce yourself, and share more about your business or organization. And I do want to encourage individuals to enable their video option. That way we can have the best virtual experience that we can. And as we get participants ready for this activity, I just want to remind you once again, here is the contact information for the team here at the Fresno Area Hispanic Foundation. We are working in regards to being able to serve the business's needs in unprecedented times. And you can, as a reminder, today's presentation has been recorded, and you can catch a live stream video on our Facebook page, and we will be uploading shortly onto our YouTube account. So please give us a like, follow us at any of these social media platforms to keep up to date with all of our upcoming activities and weekly webinars. So with that being said, I'm going to stop share here and transition on to our networking activity for today. So thank you for those that were able to join us.